Good morning, everybody. My name is Sandro Galea. I have the privilege of serving as Dean at the Boston University School of Public Health. And on behalf of our school, welcome to this public health conversation. This is really a hybrid public health conversation. Most of the speakers are in St. Louis, Missouri. There are more than 1,000 of us from all over the country and all over the world. I'm actually calling in from California, where I'm at another meeting. It is wonderful, however, to be able to connect virtually to welcome everybody to today's event. Thank you for joining us. Thank you for our co-host, the Association of Schools and Programs of Public Health. Thank you to the intellectual architects of these conversations, in particular here, our Associate Dean for Education, Lisa Sullivan, and ASPPH's Director of Education, Elizabeth Weist. Thank you to the Dean's Office and Marketing and Communications teams, without whose efforts these conversations would not take place. This event is the 5th installment of the Boston University Teaching Public Health series, which began in 2018. At these conversations, we welcome speakers to discuss how public health pedagogy can evolve and adapt to help the next generation shape a healthier world. Today, we're going to discuss a topic that is ever more relevant to the core mission of public health, how public health educational models can more effectively advance health equity. In doing so, we will build on themes raised by ASPPH's initiative, Framing the Future, Education for Public Health 2030, about which you're going to hear a lot more about. This event is going to be divided into 2 panel discussions. The first will engage with the theme, Charting a New Course, a Transformative Agenda for Education and Public Health. After a break, we will reconvene for the second panel, Leading the Change, Challenges and Opportunities in Academic Public Health. I am very much looking forward to learning from all our speakers as the day unfolds. It is really always a privilege and a pleasure to do events in partnerships with ASPPH, and in particular working with Laura Magaña, President and CEO of ASPPH. Laura, thank you for your partnership and for your leadership. I'll now turn it over to you for remarks.
ASPPH is proud to co-host this meeting in collaboration with one of our members, the Boston University School of Public Health. As an association representing 143 accredited schools and programs of public health, training the public health workforce to protect population health and achieving health equity for all is at the center of what we do and is at the center of our strategic plan 2030. We are living in historic moments where everything in our life has been redefined. The way we work, the way we live, and of course, how and what we teach. The pandemic and the other social, economic, and political forces have forced us to rethink education and practice. Higher education has been challenged to redefine its role in society. Health professionals' education has been challenged to focus more on the conditions that make people sick or healthy in the first place. And public health workforce has been on the spot in such a way that we have lost 50% of our governmental public health just in the recent years. I can't think on a better time to come together as a community of educators to talk about these challenges and to opportunities we have to create a better future. Today's conversation will highlight some of the work of the ASPPH Framing the Future 2030 Task Force. Framing the Future envisions equitable, quality education in public health for achieving health equity and well-being for everyone, everywhere. The task force is exploring 3 key areas that will shape the future of education in public health. Number 1, inclusive excellence through an anti-racist lens. Number 2, transformative education and pedagogy. And number 3, expanding the reach, impact, and visibility of academic public health. I want to thank all of today's panelists for sharing your expertise with us. And I hope that all of you in the room and online will actively engage in all the conversations. Now I'm pleased to introduce Lisa Sullivan, Associate Dean for Education at Boston University School of Public Health and Chair of the ASPPH Framing the Future Steering Committee, to lead our first panel. Lisa's co-moderator for the second panel will be, or is, Liz Weist, ASPPH Director of Education. So let's join you. Welcome Lisa to introduce the first panel. Thank you.
Thank you, Dr. Magaña, for that introduction, and welcome everyone. This program will be recorded and the recording will be posted on the BUSPH website. If you'd like to take a picture of this QR code, we can show it in the room. I think it's showing online. You can access the recording. It'll be available in 1 to 2 days. Can we see it in this room as well? There it is. Thank you. Also, here is a QR code for easy access to the Framing the Future effort, where we continue to post our work in progress and welcome your feedback on that initiative. It is now my pleasure to be moderating the first panel, Charting a New Course, a Transformative Agenda for Education in Public Health. This symposium is part of our regular series, and this year is an opportunity to share work in progress and to gather your feedback on our Framing the Future 2030 initiative. This work builds on the original Framing the Future initiative and the work of many ASPPH task forces and working groups. I have the distinct pleasure to work with several of the panelists on the Framing the Future effort, as they are part of our 3 expert panels: Inclusive Excellence through an Anti-Racism Lens, which we see as foundational and essential to all of our efforts; Transformative Educational Models and Pedagogy, an opportunity for us to rethink how we train future public health professionals; and Expanding the Reach, Visibility, and Impact of Academic Public Health, which is critical for us to ensure health equity for all. We are at a critical moment, and as you will hear, we have some tremendous opportunities ahead. I'd like to now introduce our panel 1 speakers. Unfortunately, our friend and colleague Tricia Pennycook is unable to join us today. We thank her for her willingness and preparation for this panel, and we will certainly engage her in future endeavors. First, we will hear from Amy Fairchild. Dr. Fairchild serves as Dean and Professor of the Ohio State University's College of Public Health. She also serves as co-director of the World Health Organization Collaborating Center for Bioethics at Columbia's Center for the History and Ethics of Public Health. Dr. Fairchild is a historian who works at the intersection of history, public health ethics, and public health policy and politics, and is co-chair of the Framing the Future expert panel on transformative educational models and pedagogy. Second, we will turn to Leah Neubauer, an associate professor of preventive medicine, Division of Public Health Practice in the Feinberg School of Medicine at Northwestern University. Dr. Neubauer also serves as associate director of the program in public health and director of educational advancement and accreditation. As associate director, Dr. Neubauer works closely with the Institute for Public Health and Medicine Leadership, the program director, degree concentration directors, and professional staff leaders to provide strategic vision, leadership, and oversight of all educational advancement and accreditation-related initiatives across 13 degree variants. Dr. Neubauer is also a member of the Framing the Future expert panel on transformative educational models and pedagogy. Then we will hear from Laura Linnan. Dr. Linnan is Senior Associate Dean of Academic and Student Affairs for the UNC Gillings School of Global Public Health and is a professor in the Department of Health Behavior and Director of the Carolina Center for Healthy Work Design and Worker Well-Being, one of the 10 NIOSH Centers of Excellence in Total Worker Health. She has more than 30 years of experience as a public health researcher and practitioner who works to eliminate chronic disease inequities with multi-level interventions designed and delivered in collaboration with the intended beneficiaries of these programs, policies, and environmental supports. Finally, we will hear from Trinidad Jackson. Dr. Jackson is from St. Louis and currently resides in Louisville, Kentucky. He is the inaugural Assistant Dean for Culture and Liberation and is also an assistant professor at the University of Louisville School of Public Health and Information Sciences. Dr. Jackson is also a member of the Framing the Future expert panel on inclusive excellence through an anti-racism lens. For those of you who are joining us virtually, please submit your questions via the Q&A function at the bottom of your screens. For those of you in person, we will have you line up for questions at the end of our presentations. It is now my pleasure to turn things over to Amy Fairchild.
Thank you, Lisa, and thank you, Laura, and thank you, Sandro. And I'm really sad that Tricia is not here, but I'm glad to have the gift of one of her minutes. I'm in the process of co-editing a book on public health ethics, and we're including a classic piece by Norm Daniels, Bruce Kennedy, and Ichiro Kawachi called "Why Justice is Good for Our Health." It's from 1999, And it's nothing I didn't know, but I've been struck as I'm working on this section that the serious discussions about social justice in this country really began in the early 1980s in the US. And by the 1990s, it was grounded in this really rich, powerful epidemiological evidence that was undeniable. And here today, in 2023, it's not just that we are still arguing the case for addressing the social determinants of health. We are standing at a moment in which US life expectancy is continuing to decline. We are unique among countries in not having bounced back from the COVID-19 pandemic. We're going in the wrong direction. And in part, that's a function of our current social political context, but a longer social political context. We've been becoming polarized and fissured for decades, at least since the late 1970s. It's in part a function of the increasing attacks on science, the attacks on public health, and the attacks on the legitimacy of government. And for public health, that's a double whammy, right? Because public health lives in a lot of places, but we don't have public health without governmental public health. We depend on governmental public health. We depend on the state. So that attack on public health and the attack on government has a double impact on us. And public health is under attack in a lot of other ways too. We have experienced, health officials in particular, but I know people in this room have experienced threats of violence, have experienced actual violence, and that's mirroring broader trends in our society. 2021 data from the Southern Poverty Law Center are sobering. Consequential percentages, and depending on the question, it's anywhere from 20 to 50% of Republicans and Democrats, particularly young Republicans and Democrats, and particularly men, but also women, are open to violence as a legitimate political tool. They are convinced that LGBTQ individuals are a threat to our youth, and they are hostile to feminism, among other things. Those are just some of the highlights. And state and local health officials are on track to having lost almost another half of their workforce by 2025. And that's on top of what Laura pointed out, that they've already lost 50% of their workforce. But part of the reason for our sorry state of health and sorrier state when it comes to health disparities is because we as a field continue to focus downstream. We are stuck downstream. That's in part a function of compassion. People have suffered, they need help, they need assistance. We have populations in crisis. It's in part a function of NIH funding patterns that have begun to recognize the social determinants, begun to recognize racism as a crisis, but the vast majority of funding is still going into clinical areas. But we're also stuck downstream because in the public and the policy conversation, our field has a long history of retreating into science. Think about our mantras of the past years. Facts, not fear. Follow the science. And that fear of undermining science, in doing so, we don't do a good job of talking about the values that help us navigate how we determine what counts as evidence, how we account for conflicting evidence, how we make decisions in the face of gaps in evidence. And so my group, in terms of framing the future, is making the fundamental argument that we need to pitch a teaching camp firmly upstream. We need to do a better job of accounting for the politics of public health, the levers that control policy, and have students and faculty members who really understand this and are prepared to grapple with that. We need to emphasize communications. I'm not talking about health behavior communications where we have a rich history, and I'm not diminishing health behavior communications either. I'm talking about communicating in the public conversation, communicating to policymakers, and that's a different kind of communication skills. And we're also talking about the facility to talk about ethics and values. We work in a space of democratic deliberation, and that's a space of values conflicts. So to begin to wrap up, one of the things I want to note as we talk about, and we have some specific ideas for how we pitch that camp upstream, how we move our faculty upstream, how we move our students upstream. But I want to recognize this is also a moment in which higher education is under attack. As of this morning, there have been 37 bills introduced that would in some way limit the way we teach, that are a fundamental attack on our values as a field. And 37 bills in 21 states. When I did this 2 weeks ago, it was 35 bills in 20 states. So this total is only going to continue to mount. 10 of those have passed, and 4 have been signed by governors. And mine is a state that has a pretty scary bill sitting out there, some version of which will pass. So that number is going to continue to ratchet up. So at this moment, we could do what we've historically done and strategically retreat into science to talk about our neutrality, to talk about our objectivity. But while the consequential debate of our era is informed by science, and we need our science out there, we need to be excellent science stewards. Science is not the subject of the debate that we're engaged in as a field. We are engaged in a debate about social justice, and we will not be effective as a field. This is really one of the foundational conclusions of my group. If we're not prepared to recreate ourselves, and by ourselves, I also mean our faculty, because I do think this is in some ways the choir for the most part, recreate ourselves, recreate our faculty, and then graduate students prepared to engage in democratic deliberation, because we have to be in that space if we're going to make the structural changes, the policy changes that are going to affect population health at scale. We have to be able to recognize morally salient values and priorities that are different from our own. In other words, we can't see all values conflicts as coming from a place of ignorance or a place of immorality. And we have to be adroit at shaping persuasive, credible, evidentiary arguments in light of these conflicts, and that own our values and are explicit about our values and how that shape the way we see the world and interpret evidence. And we have to be determined to stick it out and stay in those conversations. And look at that, I did so good. Right, start in it right at the 0 mark. Thank you so much.
Thank you, Amy. Up next is Leah Neubauer, Associate Professor of Preventive Medicine, Division of Public Health Practice in the Feinberg School of Medicine at Northwestern University.
Good morning, everyone. I'm so delighted to be here to speak kind of to and with, and invite you to consider what guides your decision-making about curriculum, teaching, and learning. I want to extend deep appreciation. Thank you, BU and ASPPH, for the invitation. Special thanks to Victoria Wyant and Liz Weist for all of the support in getting ready for today. I want to give a shout out to my Northwestern colleagues. I get to do this work with you every day, and it's such a pleasure. I want to give a shout out to Andrew and Adela, who are here in the audience, and several colleagues who are watching from afar. Last, my appreciation comes as an extension of my own legacy and a legacy of my own family. I'm an alumni of Federal TRIO programs, the Ronald E. McNair Scholars Program, and the Pell Grant. You might think of this something like she knows where she comes from. She carries it with her every day. And by extension, it honors the legacy of my first and forever teachers and mother. It's a legacy. Is my audio going in and out, right? Okay, I should just keep talking, correct? Okay. Oh, I really worked on this one. But it's an honors a legacy of my grandmother and mother, and a story of migration from West Texas and Coahuila to Chicago and my own upbringing in rural Illinois. For my brief slides today, I offer 3 points, a quick framing of context, and my hope is for everyone here, I am doing justice to name what the last several years have been for us as educators and administrators. I'm going to briefly review a model and offer some definitions from my own home discipline. I'm a critical adult educator, and I'll be sharing some of the thinking from that field today. And last, but certainly all the while, consider your own reactions and implications to what I'm talking about. This could be your own teaching. You know, what is she saying, making me think about, and how might it inform my practice? And for those of you in the decision-making seat, although be it your own classroom, your own unit, your own department, or your own degree area or school, I invite you to consider the why and how of your own unit's practice, policies, and procedures. Friday, March 13th of 2020, myself and colleagues received the note to head home and begin teaching remotely. In the weeks and months that followed, we all received and entangled and encountered similar messages. Abul Azam's piece at the top here came early on in the spring of 2020, demanding our pedagogy be agile, demanding we be more responsive. Numerous documents, stories, letters, and opinions ensued in what we were taking on amidst teaching during the pandemic. My longtime mentor, Ronald E. McNair Scholars mentor, Gary Harper, circa 99 for Leah Neubauer, that relationship formed, and over time, we continued to talk a lot about teaching. We wrote teaching during the pandemic, largely with 2 invites. One, to detail the need for trauma-informed response, but also as an invitation to examine why we were doing what we were doing, the how, why, certainly recognizing it came with a backdrop of emergency response. Specifically, it was the naming and the questioning of the pedagogical theories and practice that we employ. And it was also the consideration that what we do, the social function of the university, bears the power to potentially perpetuate inequities and bias already inherent in the way we're teaching, and also the opportunities or spaces that our students come from. I recognize this model might not be showing up so well on the screen. What I'll call your attention to would be the 3 circles. We have students, instructors and professors, and academic administrators. While trauma-informed is centered in the model in tandem with histories of racism and inequities, the 3 circles recognize the interrelationship and sometimes disconnect between our students, our faculty, and our academic administrators. Who decides what and why? On the one hand, we recognize teaching and learning are often very much related to longstanding ideologies, missions, practices, or policies that long existed in the case of our paper and our thinking long before COVID. Our paper quite specifically involved consideration for how you're developing the decisions that guide your teaching and learning. I offer one framework and one way of thinking. You'll note potentially in the small print at the bottom that Silverman's work is 1970. This work that's now 53 years old lives on in many teacher training spaces and educational leader spaces with a simple set of questions. What guides what you do in your educational unit? How are the various elements of teaching and learning considered? I also recognize that many of you may be using an educational philosophy or philosophies already. My intention in including it today, be it first consideration or reconsideration, is to name the role of institutions, educators, and administrators in thinking through both the thought of this work, but the action of this work. In practice, what do you believe the purpose of your educational practice is? Why do you teach the way you do? Why are you using the textbook you're using? Who are the authors of the readings your course includes? Maybe at a larger level, what do you believe the purpose of your concentration, degree, major, or unit to be? And how do you know? And also, what guides your educational decisions? In closing, I offer these 4 points. There's no denying that the pandemic in many ways exacerbated what was already there. What was already there is a long-standing recognition that our teaching and public health is not static, nor should it be. It invites consideration for what it means to be responsive to what's happening in the world and how it makes its way into our classroom or our community learning spaces. And at a deeper level, and potentially several other talks, it really invites us to consider how our choices influence effectiveness and sustainability. I invite you and your own teams to consider the place and space, the reality of educational practice in your own teaching practice and your unit. And as a collective, the invitation and exploration to consider what our charge in academic public health is for the future. Thank you.
Thank you, Leah. Now we'll hear from Laura Linnan, Senior Associate Dean for Academic and Student Affairs at the University of North Carolina Gillings School of Global Public Health.
Good morning, everyone. It's a pleasure to be here. I'm just really honored to be part of this panel and part of the discussion I know that will follow today. So my charge was to talk a little bit about education for life. What does that mean? And so my plan for the day is to actually talk about what that means and then think about the transformations we might need to consider. Who are the learners we're talking about? Who are the teachers? And what should we be teaching with what kind of methods? So you've heard some great ideas already to get us started. So I'm going to just jump right in and talk about this notion of, I had heard a lot about lifelong learning, but what is education for life? And Julio Frank and others put together a really important paper, 2 sets of papers on this topic. And they really picked out 3 components of education for life. One is learning throughout life, which is actually the idea that through our entire course, it's not just about we get our education, we do a job, we work, have a job, and then retire, but really to move far beyond that and to think about all of the cycles that we're in is a continuous lifelong learning process. But beyond that, there's also a second component, which is really the substantive information that we need to learn. And so a second component of education for life is really what we study, what is our more traditional approaches to the kinds of curriculum that we might have and so on, and that we teach and we learn from in order to be experts in a certain field. And then the third, which I think is a really important component, especially coming out of COVID, is that we think about education for life as individuals learning to live healthy lives. So all of us have a purpose and a mission, and we know burnout is such an important part of what we're dealing with in our society and in our profession. So thinking about how we actually think about education for life in that context as well. So that's part of our education for life, these 3 components. But there's been a lot of other work on lifelong learning that I think if we step back for a second and think about how it applies to public health, it could be very useful. So thinking about long life learning, thinks about this quote from Michelle Weiss. So we have to get about the business and we have to be the ones who will be affected. And so we must get to the business of building the infrastructure. So as you're sitting here today, think about the infrastructure. There's a lot of decision makers in this room and online, I'm sure. So thinking about what is your role in building that infrastructure that's education for life. There was also a really important report by UNESCO to talk about the future of higher education. And they really found that while universities continue to prioritize academic programming, they are paying far less attention to this widening access. And when we talk about equity, we have to broaden access to education. And so participation in broadening access is really important. There's also a UN Sustainable Development Goal that recommends higher education institutions require a substantial transformation into a lifelong learning institution. And when they did this survey, they found out that there were barriers to lifelong learning, things like finances, as you can suspect, but other things like no engagement with employers and many other factors that actually impact the ability of an institution to change and become more of a lifelong learning institution. The idea of a 60-year curriculum is another idea that's been put forward that I think is really helpful for us to think about, is that the curriculum that we develop today is not just a curriculum for the little slice of education that our students are coming into, but really thinking about the life course and what are the different elements of curriculum we need to be thinking about in a 60-year curriculum. So why focus on education for life now? You've already heard our society is in a place where we need to be thinking differently about education. These demographic changes are coming where traditional students are no longer the age or the demographic that we are typically seeing in our institutions. We're going to have to broaden our focus. And work has experienced rapid changes. We need to adapt to what's happening in the work environment, as well as the technological advances that we're all experiencing. Many of us started some of these in COVID, but it has expanded far beyond that. So there's a much more of a demand for this kind of a thinking as we move about putting our programs together. So what are the transformations we need to think about in terms of education? First of all, thinking differently about our students. We do have our traditional public health students that come to us, but we need to be thinking far beyond those students, the degree-seeking students, working public health professionals who want additional education, emerging public health leaders that we want to support and build up, community health workers who are out there on the front lines doing a lot of work. How can we support them in our educational missions? Other health professionals who want a little bit of public health so they can be better in their own roles, and other non-health professionals traditionally, like journalists and politicians and others. We need to think differently and transform our thinking about who the teachers are and what their role might be. So traditional public health faculty are committed to, we want those faculty to be committed to an education for life perspective. And that's not in existence in all of our institutions right now. Recruiting new teachers by engaging with alumni, other practitioners, bringing them into our curriculum and getting them involved. And the role of teachers themselves is different, more of a coaching function, more of a facilitation function, establishing performance assessments differently and really thinking differently about the role of the teacher. Transforming how we think about competency-based education. In public health, I think we've done a pretty good job of realizing we need foundational competencies. We also need specialized competencies. So we're really building our accreditation requirements and so on in that model. But then these integrative competencies, which are ones we probably give less attention to, that would be really helpful if we think about those emotional intelligence and thinking about how to talk about values, how to talk about the democracy issues that Amy was mentioning earlier. So what methods should we be considering as we're thinking about this transformation? Really using problem solving, using case-based learning, real world problems. I think we're all starting to bring those into our classroom. We can't avoid them anyway, but how we bring them in is so important. Using the new emerging technologies to be able to do a better job. How many of us are using simulations? How many of us are doing case studies, doing debates, doing modeling of any kind in our classroom of the kinds of issues that our students will be facing when they leave us? So all different kinds of methods. We need to think about our institution as well. So working towards institutional changes that support education for life is going to be challenging. But again, as administrators and as decision makers, we have a role to play in this. So flexible learning pathways. This was a new word for me that I had not realized existed before, where we're really broadening the opportunity for people to come into our institutions in an open campus kind of format. So we need to, this is an equity issue, to bring people in who are part-timers, who are trying to figure out how to better themselves in their lives and do the work that they have a real passion for. But we need to provide these pathways. And there's many different ways we can do it, but only 66% of institutions had something of that nature in place. And does your institution offer these kinds of digital learning, credentialing, other kinds of diplomas that are not the traditional degrees? There's a few that are doing this. It's a growing field. It's probably the biggest growing field, actually, but we can do better and we can do more. So in summary, just a few points to take away, and then I'm really looking forward to the discussion. So using this education for life principles for transforming how we're thinking about our public health training opportunities, and considering the 3 types of competency-based learning, rethinking how we think about students and learners, and integrating new technologies will really help us to build the kind of equitable approach to education that we all are striving for. So thank you.
Thank you, Laura. Our final presentation will be delivered by Trinidad Jackson, Assistant Dean for Culture and Liberation and Assistant Professor of Promotion and Behavioral Sciences at the University of Louisville School of Public Health and Information Sciences.
Hello, everybody. That was weak. Hello, everybody. 8 minutes. Does the consciousness of academic public health reign supreme, or is it dominated by supremacy? So if we lived in an ideal, aspirational world that actually valued humans and the sanctity of our existence, when we look at this image, it will resonate. We would see ourselves in this image, right? We would get it and feel the warmth of that sun. We would feel the support and the cultivation of those hands saying, yes, go thrive, go be great, and enjoy your individual freedoms, also amongst your collective freedoms. But this is the reality for many of us. Some of our identities, some of our communities are subjected to legacies of human rights violations, bondage, and murder. And so how did we get here? Well, organized supremacy is how we got here. I have white in parentheses because I do want to acknowledge that supremacy has organized itself within societies historically, right? So outside of whiteness, supremacy has existed. It's critical for us to note, though, that the current context of what we're contending with globally has been dominated by the culture of whiteness. And additionally, when people are primed to think about what the concept of white supremacy is, the default is potentially a hate group, right? So the KKK, for example, established in 1866 after Emancipation Proclamation was ratified. The issue is, right, when we think about Andrea Smith, who's added an additional conceptualization of what white supremacy is, it includes constructs such as slavery and capitalism, genocide, colonialism, or Orientalism and war, so othering people so that we have justification, quote unquote, to remain at war. And when people attempt to contend with some of these constructs, they do it from the perspective of distancing it in the context of time and geography, right? So slavery, over 100 years ago, get over it, we're past that. Colonialism, good things came from colonialism, right? Europeans brought civilization and education and religion to societies who otherwise would still be living as savages, right? That's some of the revisionist history that the ruling class wants to maintain when we talk about learning critical aspects of critical consciousness, racial consciousness, et cetera. And so when we consider constructs such as these, how do these constructs interface with academic and practice agendas for public health? Well, according to Public Health's Code of Ethics, it is our duty, right? We are ethically responsible for using our knowledge, our skills, our experience, and our influence to promote equitable distribution of burdens, benefits, and opportunities for health. And we are also ethically responsible for engaging, disrupting, dismantling institutions, structures that facilitate inequities related to voice, power, and wealth, right? This is in our code of ethics. And so what does that mean then, as one of my co-panelists mentioned, about the consciousness of public health? Where are we? How have we been practicing? And so this framework, right, it illustrates the consciousness of public health, what we have done and what we must do, right? So we have done too much of attending to the risk behaviors, the disease and injury, the mortality, and putting the onus on people who are suffering from those at the most disparaging rates. Ignoring the ruling class, right? Those who are creating the social inequities, the institutional inequities, and also the poor living conditions that we must contend with. And so if you look in that left category, social inequities, and we assess that for, well, who's the ruling class in each of these categories? Well, we know it's higher socioeconomic status. When we look at race and ethnicity, we're talking white dominance, again, white supremacy. We're thinking about gender, we're talking about patriarchy. And so to what extent has the consciousness of public health contended with that disparity of who's the, even within us, right? We're in this room and we're saying, we down for public health, right? We are the arbiters of what public health is and its grounding in social justice. To what extent are we assessing and interrogating ourselves and getting out the way? This is a tool that I use in my spaces, especially leadership spaces where people are making decisions. And it demands for us to interrogate our individual selves, but also the collective, right? So what does this constellation look like? Who in these decision-making spaces lie above the domination axis? Who in these spaces lie below the domination axes? So who's in domination, who's being oppressed, who's present, who's absent, who should be centered, and who should be relinquishing power? This should be consistent practice for us every day. And so to touch on a couple of examples that many of us might be familiar with, and tie this back to some of those constructs of supremacy, many of y'all are familiar with, right, Stop Cop City. A little genocide for you, a little capitalism for you, throwing a little bit of colonialism and war as well. So the process of defending a forest that sits on sacred indigenous land, but also in a Black community, the citizens of Atlanta have uprised and said, hey, we don't want this training center to exist within our community. And we see what happened. An activist was murdered in the process, and the city gave hours upon hours of testimony and said, we don't want it. Council voted against the people's interest anyway, right? That's public health for you. Additionally, in Louisville, Kentucky, for example, we don't have zoning laws as it relates to alcohol sales. And so as part of one of our research initiatives, I hired young people, actually marginalized communities, engaged them in social justice youth development so that they can understand violence isn't just about direct violence. We also have to explore, contend with, and fight structural and cultural violence. And so in that process, Family Dollar wanted to put the dollar over the family and acquire to sell liquor in Western South Louisville, the areas that contain the most Black and brown people in the city. So I work with the young people to organize, mobilize, educate their peers about alcohol and substance use being one of the risk factors for violence in our communities, right? That doesn't make sense. We don't have zoning laws for it. We allot licenses for that, but we're saying, you know, we want to be anti-violent. And so alcohol said no due to community protests, right? So critical social action. Additionally, we, fresh off the heels of our Department of Justice report with the murder of Breonna Taylor and an investigation into our police department, we're sitting in St. Louis, who's also had their own process of a DOJ report and consent decrees. We are now at the table with Collins and a number of other activists who are demanding the people's consent decree because we're saying we are not fully trustworthy of our government to deliver the demands that we want through a negotiation process with the Department of Justice and our city government. Additionally, movement for Black lives, right? So that, again, what I'm getting at is there are a number of agenda that people in community who are directly impacted have said, hey, we are prioritizing these things. If we ask ourselves in this room, to what do our research agenda look at ending the war on Black people, investing and divesting, thank you, reparations, community control, political power? How many of these are priorities on our research agenda? This pyramid here is the Equality Institute created. It's called a pyramid of white supremacy. What I want us to attend to here is the bottom level, which is indifference, because that sets the foundation for all of the other structural, cultural, and direct ways that white supremacy and its violence cascades across our society. And so how do we contend? How do we intervene with indifference? And I'm at 0 time, y'all, so I'm about to fly through the rest of this. But it's right. So we know that that's through philosophy of education, ideology. So look at how we're being educated. Look at how we're being conditioned in society. And so to what I do with my students is I expose them to the different philosophies of education so that we're understanding who created this philosophy, this way of learning. How are we engaging in practices? What's the role of the student, the role of the teacher, and how does that impact our conditioning? How does that empower us? How does that facilitate critical inquiry of what we think we know? And so, right, we know that that is one of the interventions, that is one of the most effective interventions, and that's why we see so much banning of quote unquote CRT curriculum or DEI initiatives at universities. And so this, for example, is in Kentucky. This was a bill request filed in 2021. We fought against it in 2022, but right, it states outlawing of designated concepts related to race, sex, and religion. So this just isn't about race. This is about ensuring that we're not understanding that the dominance of Christianity and the oppression that has occurred within that religion is kept secret. This is ensuring that the patriarchy isn't overthrown. This is to ensure that white supremacy isn't dismantled. And so, oh, there we go. Snapshot of the bill request. Here we have some preliminary findings from some of my research using a colorblind racial attitude scale with high school students. This is essentially saying that they want this information. Racism is not a problem. It's one of the questions on this survey. They believe it is, overwhelming majority of the students. Racial problems are rare and isolated in the US. They don't believe that. Racist history should be taught in school. They want it. And so for us, if we are to educate and facilitate critical consciousness and socio-political action to break us from these bonds of oppression, it is critical that we understand that we are at war. We are in fights against systems of oppression. And if not, we will continue. I'm gonna let that chill before I get emotional. But we will continue to contend with this, right? I will continue to have to contend with my young people dying that I employ, or living in 2 cities, St. Louis and Louisville, living through uprisings and the trauma that manifests because of that. So for me, I think it's critical that we all orient ourselves to liberation frames, right? It's not something that we can passively do. We have to actively engage in the practice of liberation if we want to be able to envision ourselves in imagery that says, hey, we're breaking bonds, we're free. Thank you.
Thank you. Thank you, Trinidad. And thank you all for your presentations. We are now going to move to a discussion with the full panel. I'll kick things off with one question. 9:51. For those of you who are joining virtually, again, please submit your questions through the Q&A function at the bottom of your screen. For those of you here in person, we ask that you line up at the microphone and that are placed around the room for questions, and we'll take them in turn. So thank you all for your presentations. I'd like to start with one question, and anybody can jump in. I was struck by Dr. Magaña kicked things off saying everything has changed. But listening to the presentations, not a lot has changed, and there's so much more work for us to do. I know we have lots of faculty and administrators both in this room and with us online. And I wonder if you could give us, as faculty members, any advice on how we manage these transformations, putting at the forefront our values, our duty, our purpose. What words of encouragement and support might you have for faculty and administrators at a time that we're all feeling tired and burnt out, yet excited about and feeling responsible for all of the changes that have to happen?
I'll do a quick response first. I can just tell you from a personal perspective, I was feeling all of those things, and the thing that energized me and excited me was finding a research project that really invited me to dig into the backlash against public health, really understand violent extremism, really understand. We'll be talking about this some later, so I won't talk too much, but having an intellectual agenda and coming at that as a person who's committed not just to having my voice sound in the pages of journals, but being part of the public conversation. And it does require being willing to lose something in the face of doing this, being willing to be censored, being willing to be fired. And I know that we have examples of that out there, but I do think that's part of what we have to do. And I think when we throw ourselves into this work and make it a priority, and as leaders create an environment where you protect as much as you can faculty who do this work, and then faculty who are the spokespeople, who are the stewards of evidence, who are the stewards of our values. That's what we do. And I know it's hard in states that have passed laws and states that are cracking down. But I think too, we can think about what kind of safety net do we create as a community. If we have political academic refugees, how do we begin to support people in place, but how do we begin to create safe havens in the institutions where we are?
Yeah, it's such a great question. I think each of us are in different places in our careers, and I think what gives me hope is that the students that are coming into our programs now have lived through a lot, and they are not willing to sit back and have the same old stuff happening in our classrooms. And so they give me hope. They also challenge me and challenge us as a faculty to really move beyond where we are right now. And I think we all can think of faculty who are not, I had that one line in my talk about, we have to have the teachers who are able to have these discussions, to really get into it in the classroom with students, and to have projects that challenge them to move beyond, the status quo, to look at our readings, to look at who's benefiting from getting certain publications out, who are we lifting up in our syllabi. And I think that gives me hope, because I think our students are challenging us. And then I think we've just got to be, willing to take on, as I think what Amy is saying, the recognition that, we can help elevate faculty in our institutions who are doing this work in ways that will lift the rest. I mean, it's not going to happen overnight, but to me, we do have to have an environment where our faculty who are doing this work, I think of Trinidad, we were talking earlier about the work he's doing, which is so thankful for folks who are doing this kind of research and projects, engage more with our community, because if we do it on our own, we're not going to be successful either. We have to do it with community. And we have some experiences in Chapel Hill where our capstone experiences now, we start with community. What do we need? What would they like to work on? And then we are doing projects with community that they want to work on, not the reverse. So just as simply as asking community, what is needed? How can we help as public health folks? And how can we engage with you to help build capacity to do the work you want to see happen in your community? So those are the kinds of things that give me hope. As a couple examples. So
add to what Laura's mentioned, right? She just stated what is community's focus and start from there. So that's central, as I just mentioned. There are a number of agenda that have been standing for decades. But additionally, to the central question, I think about to what extent have people in positions of power in public health had to contend with oppression being central to their identity and the way that they navigate society every day. And so then how equipped are you to fight, right? How prepared and how equipped are you to understand what a conceptual model, right? Everybody loves models. What does it look like to understand power, leverage, organize and mobilize in ways that we need to, right? Because again, we're talking about, Dr. Magaña mentioned the socio-political and economic landscape. These are all facets that we have to navigate, not just as public health professionals, but as individuals. Everyone in here, we are global citizens. And so how does that does it translate? Does our individual experience as a human being, does that translate into the classroom and to our professional spaces? And so I think we have to wrestle with that. Are we prepared to organize? Are we prepared to look to the civil rights movements or movements prior to that to understand how those who were targeted by different supremacist actions, how they organize for their liberation? Are we doing that? The answer is no. So that's what we have to do.
If you have something you'd like to share, please.
Thank you for the question. Two quick responses. The first being a question. I'd wonder, what are the truths and the realities for how you are compensating and retaining your teaching faculty? And also, what does it mean, right, to have folks who teach in your unit? Are they clinical lines? Are they teaching lines? Are they tenure track? I think regardless if you're in a teaching or a research intensive university, I think we need to be very real about some spaces seeing teaching as less than research or less than other things. So I think really naming that in tandem with how are we compensating folks to revamp their courses. And I know, some units have formulas and it's really interesting to think about, what do we expect for a course to be updated? And when are we in spaces where we're asking more of our faculty and their time should be compensated? The second and related piece is just to acknowledge, one of the things I think we are learning to continue to do well at Northwestern. I'm looking at our MPH director of community partnerships and saying this, which is our community partners are teaching in our program. They have adjunct appointments. And when that works for them, it works well. The other option is consistent guest speakers and compensated guest speaking time in our courses. So I think we are still thinking and learning what it means to have real world public health in our curriculum. But if you're sensing a theme, from my comments, it comes with attention to time, dollars, and cents.
Thank you. Thank you. Let me take some questions from the audience, please.
Good morning. My name is Kim Ramsey White. I'm from University of North Carolina, Chapel Hill. And really, I know I stayed standing here, even though the panelists answered most of what I was going to ask as far as a question is concerned. But I stayed standing here because I still think it's important for us to reiterate and understand, what Trinidad presented is really the foundation of what it is that we have to do. And people got to get comfortable with that conversation. People have to get comfortable with being uncomfortable. That's a cliche at this point, but that's exactly what it comes down to, because everything that Laura and Leah and Amy put forth, if it doesn't start foundationally with the work that Trinidad presented, it's just kind of like us talking about it. So ultimately what I wanted to ask, and everybody brought it up, it's how do we get our faculty to do it? We've had this conversation a million times. We're not really saying anything that we haven't said before. And I don't know that we'll get it answered here today, but my question is, what's the path forward? Not just talking about it anymore. That's the one thing I've learned, is that we all know good buzzwords to say to make it seem like we're moving the work forward, but there's really no substance behind it. How do we do that?
Still want us to comment on that, doctor? So I'll actually mention that, right? So this is being recorded. And we're in here talking about what we need to do to fight the powers that be. I've actually been fired twice in my state. Won't get into it, but because of doing this work in the state from which I come, right? Kentucky is legislative makeup, et cetera. And so I think while we're having this very public conversation and uplifting what the overarching issues are, I think, you know, when these cameras go off, that's when some of that real connection about what we should actually be doing, to get to your point, should happen, right? We shouldn't be leaving here without structured plans about how we move forward, because laws are being passed. Bills are being filed daily. And so we have to understand that this, to your point, this ain't just a feel-good conversation where we come up, make talking points, and leave on Friday. What are we actually doing in this space over the next 2.5 days?
Thank you. Amy, please.
Let me just add one thing, because I've been at a lot of 3 institutions now, tried to crack this problem a number of ways. It's sort of mandates, strong incentives. And I think the thing I see happening at OSU now was a really powerful call by students. I mean, it's like students have to wake up the faculty. It's going to feel forced. Students have to wake up the faculty, and frankly, students have to scare the faculty a little bit and make them understand you are in these spaces, you're in hard spaces, you're in tough learning spaces, and students are expecting you to be able to have these hard conversations. They're expecting you to have this foundation. And what I've seen as OSU is a faculty member who has really stepped up and is galvanizing faculty from below. And if you can support that person, and that's what we've been doing at OSU, is how do we support that person? How do we get that person into the spaces where faculty can really hear, talk, begin to build that faculty coalition? And then it's going to be peer pressure, which is going to be far more powerful than dean pressure, I think, to do this work.
Since Kim is my partner in crime, I just want to say that there's no easy answer here, but I love Trinidad's like, yeah, let's get about the work of putting some real action plans together. But I think in our institution, I will say that we are coming at it from a bunch of different angles. And, we have inclusive excellence, which Kim leads, and academic affairs, and we partner on some things and training opportunities. But we all know who comes to the trainings if they're voluntary. It's the folks who are doing the great work already. So it will take time. I do think that if you can elevate the stars, which we all have stars, we have folks who get it, who are teaching it, who are engaging with their students. And then, through a whole host of steps, it doesn't happen overnight. Sometimes it does if it's a problem, but, you're moving people into different spaces than in the classroom. And I think there's a way to do that. It's not easy. We have 300 some faculty. So not all of them are great teachers. Not all of us are great researchers. And I'm speaking myself too. I mean, we all have strengths, but not everybody belongs in the classroom. And so there are times when we have to take real action to move people. And we were talking just the other day about putting development plans together for folks who they're getting bad course evaluations. The students are complaining, we know who they are. And we don't base it just on course evaluations because we know those are biased as they are. But the idea of really taking action and holding people accountable is the only way we're going to be able to get this turned around. And then I guess the last thing is just providing learning opportunities for people who are really eager to sort of turn the corner on some of this work. And we don't have necessarily the right learning opportunities always available to us. So that's where partnering with community to come in and actually be part of those conversations, I think, is a really good place to start.
I'll just respond to say thank you so much for the prompting and the foundational grounding I would extend Amy's comments to say it should be or could be top down, bottom up, side by side, and all in between. Trinidad's slide on philosophy, offered the B word, and the B word being behaviorism. And for folks familiar with ed philosophy, right, behaviorism has manifested in academic public health. We are a competency-based field. Competency-based education is core to behaviorism. And I think, really understanding some of those roots. I asked someone once, I'm like, how did we get here? They said, it's behaviorism. I blame the psychologists. And I thought, wait, what? But we heard this from our students at Northwestern, which is, why are there so many health behavior change theories with no acknowledgement of social and critical theories? Or rather, those courses, that talk exists, but outside of the core theory class. And this was several years ago, and we really listened on the student voices, and it matches very much what Dr. Jackson's slide is inviting us to consider, which is we have to do more, to be frank, than what I hear a lot, which is, well, why are you doing this? Well, we're doing it because CEF required it. And I think, and related, we understand this is foundational and entry-level guidance and standards for our field, but that's the floor. And count me in for a ceiling that is way more than behaviorism and is much more to collective solutions.
Can I add one thing here too? And we've talked about this. So I agree and absolutely with what Leah just said. And but we can still take those same CEF guidelines and center something very different and meet the guidelines. So that's why I said, we're stuck in a lot of ways, and we need to shake ourselves up and need to shake our thinking up.
Thank you. Thank you. Next.
Good morning, Elena Zami from University of Miami. I want to say you have invigorated me for the beginning of the conference, and I have learned a lot. I want to start with a question that was raised about who decides and why for teaching and learning. And I started thinking about design teams. Who are the people who need to be participants on what is it we teach? Probably not me only as the faculty. And I connected it to the lifelong learning of strategies. Who do we teach? And then I thought about, there is a special moment right now in discussion of this learning and teaching about public health belongs at all levels. The discussion started with Dick Riggleman about high school, before high school. So the question I have here is that, how do we create that spice of urge and interest in learning that's lifelong, and it's connected to our field of public health? Because while we have wonderful students, part of the structure is that as faculty, how many times you've heard, is this going to be on the test? Is this going to be on the exam? How do we capture the young generation, not only in college, but before that, that says learning is part of living. It's like breathing. And public health is not a discipline out there that we seek out when there is a pandemic. It is part of healthy living, long life. And discussion of social justice is just part of our lives. Thank you.
Can we have that on record, please? Because actually what you said, it was really a comment about what we need to do, right? So I do think, when I was doing some preparation for this, and I was really getting into sort of the lifelong learning and education for life literature, it was clear to me that we need to start earlier. And, thinking about how our education system is right now, getting anything else on the curriculum, it's just, if there was a way to sort of wave the magic wand, there would be an opportunity to sit down with the existing curriculum in the younger ages and bring public health into it, right? So not adding new, but adding public health examples and so on into it, so that people could see public health for where it is. I don't know how many of us probably grew up not knowing what public health is, and all of a sudden we found ourselves in public health. So the idea of what it is earlier, at an earlier stage, because it is part of life. And then I think the other thing that I heard in your comment, which I really resonated with, is the notion of critical thinking, just really opening your eyes and just saying, why is this the way it is, and digging in. And I think it gets at some of the ethics, it gets at some of the values that we need to start a lot earlier. And I think in our schools right now, unfortunately, what's happening is people are Xing it out. They're taking out anything that could be even, like my sister was a 7th grade teacher. Just unbelievable what constraints are being put on, at the younger ages and now in our universities. So I guess my answer, it's long-winded, I apologize, but just the idea of starting early with examples of public health would be great. And then thinking about, all of us embracing the idea that, we're all learning. This world is changing really rapidly. And if there's a way for us to plug in, it's not opening up the university, this open access institution where people are coming and going, as opposed to it's just a destination and then you leave. Think about our institutions. We all may have lifelong learning institutes, but how are they being utilized and by whom and when? We really need a different mindset about that. Maybe employers will force us to do this because they're demanding workers have more training. So they're forcing us to respond to that in some cases, or they're just moving outside higher ed altogether and doing their own thing. So maybe there's an opportunity there to also get this notion of lifelong learning really mobilized, because right now it's just limping along. I don't think we're there yet. Thank you. Next question.
Hi, good morning. My name is Leah Alexander. I work at Meharry Medical College. We're a historically Black academic medical health center of some type. So Dr. Jackson, when you said we were recording, I thought I should maybe go back to my seat, but I'm here now, so I'm gonna ask my questions. At Meharry, we have an unspoken hierarchy really of schools and programs with a focus on the medical school and the dental school. And my students feel like stepchildren sometimes. They just feel like they're not a priority as much as we try. And even though, we know that public health really is the foundation for everything that's happening at Meharry, there's leadership that believes that. So we're trying to be transformative and trying to, of course, collaborate with the bigger schools. But I'm just wondering if others are facing those types of challenges, and what are some thoughts about solutions? And then my other question is specifically for Dr. Jackson. I want to know about your title and because that is transformative. It doesn't fit our usual, academic models of how we call deans and assistant deans and things. So I would just like to know how you were able to manage that and what you do in your role. Thank you.
So the title, again, we're being recorded. I won't answer your question comprehensively.
Lunch.
So let's go back to 2020, right? So some of my co-panelists mentioned this new awareness that people had about racism, right? As we looked at non-traditional instruction for kids who are, structurally marginalized. We also had Ahmaud Arbery, Breonna Taylor, et cetera, who had been murdered, right? So we had banks, cities, states, you name it, people were coming out with anti-racism declarations and also declaring racism as a public health crisis. University of Louisville was no different. Our then president at the time made this bold statement that we're going to be a premier anti-racist, metro institution. And she challenged a number of, units, departments, et cetera, across the university to formalize chief diversity officers. And so School of Public Health was not exempt, right? We had a diversity committee chair, but there was nothing from a structural and institutionalized perspective that existed within the school. And so our dean, Craig Blakely, he formalized that role. And so they, interviewed people. I got the position. And so when I got the call for the offer, I asked, let's have a follow-up conversation, because I'm not operating under the language of DEI, right? That has served us, at this time, it can serve us a very minimal purpose, right? When I go into spaces and I'm talking about white supremacy, cultural violence, structural violence, but it's under a title of DEI, people look at me and falter to, hold on, that's not DEI, that's not what we're here to talk about, right? But when I go into a space talking about such constructs, and I'm doing it from a culture and liberation perspective, that's everything. And so for me, that was a non-negotiable for me. Either I'm changing the title or you can offer the position to someone else. And that was a little back and forth, right? Oh, liberation, what does that mean, right? Black man coming into space talking about liberation. You know, and my response was, hey, you know, y'all academicians, this liberation, psychology, liberation, theology, you name it. Go look it up and do your homework. But that's my stance. And we can, you know, we can take it or leave it. And so the response thereafter was a couple of days later, you know, it's time for us to, you know, chart a new territory, et cetera. Right? So long story short, that was my non-negotiable, and I, you know, navigated that with our dean, and here we are. So, and you mentioned what I do in the role. We can have that conversation, but I'll definitely say it's organizational.
I'll find you at lunch.
So organizational transformation work in Kentucky.
Thank you, Trinidad. I'll pick up on the other half of your question and pick up on that theme, because it's also asking about liberation from medicine. And I'm a historian in public health, so I'm a bit of an odd duck, and this has been something I've been interested in my whole life. And so I think the first step is to as much as you can, get out of medicine. Now, you still might be in a health sciences center where all the research ties you there. So I think a strategy that's really helpful is to align yourself with the university as much as you can. Align yourself with, make those connections, inroads to sociology, to anthropology, to history. I mean, that's going to be how you get out of that behaviorist mindset and form those connections, create interdisciplinary programs. I can tell you at OSU, there's just such an appetite for that. And I'd be happy to talk to you about how we've navigated that at different places, but that would be, you know, cast your lot in with the greater university.
Thank you. Thanks.
Let's try to get a couple more questions in.
Sure. I have a question from the Zoom. In the 60-year length education model, is there a place to continue to educate the alumni who are practicing public health and did not have such an up-to-date education, especially around socioeconomic and racial equity issues?
Beautiful question. Thank you for the question on the 60-year curriculum. Yes, there is a place. Are we doing it? I would love to hear from some organizations that are. We've done some training for our alumni, but not nearly enough. And that's a great example of opening up the institution to more and better. So thank you for that question. Absolutely. Okay. Yes.
Hi, I'm Craig Andrade, Associate Dean of Practice at BU School of Public Health. I stand here feeling hopeful and anxious. I also stand here at a university where we have leadership like Lisa and Dean Galea, where we are able to find ways to navigate the less navigated territories in all kinds of ways. And having in all of my career in nursing and health promotion and late to public health, have never been in front of a professor of color. And I feel the urgency of broad spectrums of people that don't feel under threat, otherized in all kinds of ways. And our students are in the center of that. And we've been talking about behavioral change and things like this. This is a structural change. I was on an anti-racism work group for the university focused on anti-racism and climate change, and trustees were suggesting that we can't talk to community in a liberal state that tries to consider themselves progressive. So there's bastions of looking for change while we're also in this transition point where we're trying, broad spectrums of institutions are trying to hold on to power, and academia is the most hierarchical institution that we have. I'm waiting for us to rip the roof off and pull the walls aside and bring community in. And we're still having challenges about, is advocacy a core competency? So I guess part of my question is how do we find ways to organize amongst ourselves? Because it's not, the students aren't going to be the main levers of making this change. It's not going to come from the top. And I feel the urgency of now that 60 years in a life course learning, I sometimes lose that hope that it's just going to take attrition for this change to happen. We're going to have to wait for the old people to die and new people to come in. I don't think that that has to be that way, but I also can't, I'm having difficulty seeing the revolution coming from within inside. So I wonder what people think.
Response? So a lot of I'll just go ahead.
Trinidad, we got to talk.
I'll just say it can't come only from inside. I do think we have to bring employers, we have to bring the community, we have to bring others into this conversation. And that is challenging, I get it. But when that happens, beautiful things can happen. And it won't happen overnight, but we got to start. I mean, that's the whole point. We've got to start. One last question. Sorry.
Okay, sure. Okay. Hi, I'm Catherine Mason from Georgia State University. Thanks, Carlos. So I was wondering about the panel's thoughts. I agree with my colleague here in terms of I want to kind of blow things up a little bit. I'm a biostatistician by training. I also do a lot of measurement work. And so my sort of safe and happy place is thinking about units and metrics and whatnot. And I think that in terms of faculty incentives, Leah mentioned this a little bit too, the way that we measure faculty workload is absolutely critical. And the way that we measure it signals what we value. The way that we pay our faculty signals what we value, who we give tenure to or not signals. And that feels very intractable, some of that. What we require of our faculty, the way we actually sort of dictate workload. We're practitioners when it comes to, most of us aren't scholars of teaching and learning. We're practitioners on the teaching side of things, but we require no teaching, continuing education. You know, we talk about lifelong learning or education for life, but we don't require that of ourselves. And a lot of us weren't taught any of this when we were coming up. So that's my sort of one thought on the metric side. The other thing, and thinking about the transformation requirement, and sort of really one of the things that I felt very constrained by is the Carnegie metrics, right? We measure learning by time in the classroom. We've shifted to competency-based learning, but we're still trying to fit it into an entire system that only measures progress by credit hours. And how do we open up access and think about micro-credentialing and thinking about this education for life if we can't get away from this sort of industrial measure of learning and outcomes?
So, yeah. So one of the things I would point out is what's unique about the work of this group is that we're looking at recommendations across a number of dimensions, not only what needs to happen with students, but also what needs to happen with faculty. And that includes the training, and then what needs to happen at the institutional level to address precisely this. Because if we don't hit recommendations at the institutional level and begin to do precisely what you said, you're right, it's not gonna happen if it's all forced into the classroom without addressing all three of these levels. Go ahead.
Thank you, Catherine, for both the comment and the prompting. I wanted to share one example from our debriefings as a panel, which is around dosage. 56 credit hours. Well, that's the quarter speak for an MPH degree. And I had said, wait, so what's the story behind the 56? How did we get here? Who determined what was enough? Very classic adult educator question. No one knew. And then eventually we heard, and it was someone from CEPH that said it was 2006, when the minimum credit hours was put forward in this context for MPH. And for me, right, in my own training and thinking, that was just a moment of Okay, but why? And who was there? And who decided this? And I know several of you we've discussed, our degree looks maybe a little thicker, right? Or a few more courses than other degrees. And all this to say, I think that I appreciate the comment and the consideration to dosage. And in this example from our panel, it was focused on who decided the MPH degree needed to be these number of hours. Thank you for raising that very much.
Yeah, thank you so much. I'm sorry to cut this off, but we are at time. And I want to thank the panel. And if you could please join me in a round of applause for our panel. For those of us here in St. Louis, we will certainly continue these conversations. We welcome all of you to join us for a brief coffee break ahead of panel 2, which will be moderated by Elizabeth Weiss, Director of Education at ASPPH. Thank you very much.